Good morning. My name is Gail Fellows. My husband and caregiver Bill and I live near Windsor and will be celebrating our 55th wedding anniversary next week. I was diagnosed in Windsor in 2013 with leiomyosarcoma, a soft tissue tumor in my abdomen. The urologist in Windsor who shared the results of my biopsy didn't know very much about that type of cancer. We didn't even know what sarcoma was. He suggested we go home and Google it, and what we found did not look promising. Shortly thereafter, we were referred to our local cancer center and were advised that because of the rarity of sarcomas, treatment was not available in Windsor, and we would be referred to Princess Margaret Cancer Center in Toronto. Thus began my 5-year journey dealing with the disease. Fortunately, we were directed to Dr. Rebecca Gladdy at Mount Sinai, who has been remarkable for me. I have had 2 radiation courses, 4 major surgeries with 2 metastases, one in 2015 and another last year. I continue to travel to Toronto every 4 months for CT scans and consultations with Dr. Gladdy and a thoracic radiation oncologist. Even though it is terribly stressful going to Toronto for lengthy treatments and for my routine checkups, I am forever thankful for Dr. Gladdy and her outstanding team. She is truly compassionate and informs me of anything and everything. A few tears have been shed and many hugs have been given, but the good news, I'm still here. Thank you.
My name is Cassius Giselle. I'm 36 years old. I was born in England and I moved to Toronto in 2013, October. I had this weird sensation, this burning sensation on my elbow every time I had drank alcohol, pretty much excessively over the Christmas and New Year period. I was diagnosed with a synovial sarcoma in the month of May. When I went in for my diagnosis, I remember the doctor telling me that I had 2 options: to either have it removed by him and then send the mass off for a pathologist report to come through, or I get seen by a specialist. At that point, I already knew I wanted it straight away out. I remember walking into the hospital and then sitting in the waiting area and just thinking, how am I going to tell my folks and my family what I'm going through currently, because I am the only one in England, from England, in Canada. It's amazing, super funny, and I've only now, after started reading it, start talking about my cancer and my diagnosis and talking about seeking help. So this has been really inspirational to me. I'm still reflecting after 2 years. I've just started seeking.
I've heard of sarcoma with Terry Fox, and I know that it's much better for that kind of cancer now than it was when Terry Fox passed away. I also had a cousin in England that died of sarcoma. I'm ready to move on. I'm trying to keep a positive attitude all the time and doing some things that I want to do, taking each day as a blessing and grateful for those little things.
Hi, my name is Dawn. I'm 41 and I live in Toronto. I received my diagnosis in 2015 after an appendectomy, and the results came back as stage 3 low-grade uterine leiomyosarcoma. In addition to the surgery in 2015 when I was diagnosed, I had an oophorectomy in 2016. So at the age of 39, I was put into induced menopause. And I'd certainly say that I had some challenges dealing with the diagnosis at the age of 38, between managing my career and relationships and the side effects of induced menopause. It certainly has been quite a challenge for me. Prior to my diagnosis, I don't think I've really heard much about sarcoma other than the legacy of Terry Fox, but certainly never knew that there were gynecological sarcomas. So I'm super thankful that there's this symposium that focuses on sarcoma and in particular gynecological sarcoma this afternoon. So thanks for having me.